Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Hey everyone, yet another Friday fun day. Yes, you could tell I record a lot of my episodes on Friday and I have this end of the week energy, as we're approaching the weekend, because that's an opportunity to reconnect with your loved ones, with your friends, hey, even with yourself, right? And today, this episode is very special because I've been for quite some time making connections in my head between heart disease and other ailments, right? Longevity, shortening ailments that we all know about, things like cancer, for example, or brain health. And I am super excited to welcome my guest today because she is going to take us into the brain health pathway. And if you've been following the news, perhaps, or the literature, you know that just this week, one of the drugs that we've been using forever has actually been shown to potentially be very promising for Alzheimer's disease. So I call it old drug, new trick. And so if you stay with us till the end, we'll touch upon this, we'll discuss this so that you can get a little bit more information. But without further ado, I am welcoming my colleague, Dr. Cynthia Libert, who is a star functional medicine practitioner, somebody who I look up to because she has wisdom and expertise that she brings together to take care of her patients. Dr. Cindy, welcome to the show.
Thank you so much, Dr. Regina. It's a pleasure to be here, and the feeling is mutual.
Oh, amazing. Thank you. So I'm going to ask you the same question I ask all of my guests. They all know is that how did you grow up to be who you are today? Could you tell us?
What a beautiful question. I'll do my best. So I grew up in the Midwest. I have one sister, two loving parents, and just a really kind of golden childhood. I was, really involved with sports and academics. And so I'm very fortunate and blessed that I had a beautiful upbringing. And I attended St. Louis University for my undergraduate degree in biology. And so I got to study, this liberal arts education and philosophy and theology and just a really good foundation.
Those were the good old days before artificial intelligence, right? Let's just frame it. It was in human development. This was the pre-AI period.
Yeah, we didn't have, the internet.
Exactly. We didn't have the internet.
And, I remember back in first grade playing on the playground and just knowing I wanted to be a doctor when I grew up. So it's a long-standing just calling that I've had. And so I went straight through, college and right into medical school. I went to Loyola University of Chicago, and that was a beautiful experience, quite challenging in terms of the sleep deprivation and the stress. And so that was an entry into a long process of occupational stress, and I had a burnout situation early in my career. I had three daughters. I have three daughters, got pregnant for the first time in residency, my third year of family medicine residency. So that, and then went right into private medical practice and rounding at the hospital and the nursing homes and hospice and attending to patients in the office. And so just, a lot to balance as a young mother. And I also had this sort of disillusioning experience with family medicine. Unfortunately, I always, I went into family medicine because I love people. I love spending time with them, hearing their stories, and really being creative and looking to find solutions to health issues. And unfortunately, it in reality, in the insurance-based system, when you're so, time pressured, it's all about, reviewing the labs and prescribing the medication or referring to a specialist for procedures or more invasive care. And that was disillusioning and really sad to watch my patients decline over time, despite the best of modern medicine, of, early detection and aggressive treatment with pharmaceuticals. And so I knew that we were missing a piece of the puzzle in terms of lifestyle medicine and nutrition and fitness and stress management. And it became glaringly evident in my own life. So that's sort of the roots of how I shifted into integrative and functional medicine is my own experience, disillusionment with family medicine, the conventional approach, and my own burnout and health challenges as a result of the longstanding occupational stress and just the mindset challenges that we go through in medicine of, everybody else is more important to take care of than myself. And, just, of course, we want to be selfless and serve others. But part of the process, as you know, of being a successful doctor is to take care of yourself. And so that you can show up in fullness and vitality and be able to help people.
I think you bring up so many fantastic points, but I'm going to say you're like my sister from another mother, right? Because we're in the same generation and we've gone sort of through the same path. And, unfortunately, traditional medical system churns physicians, it breaks them, but it also breaks patients. And so what I'm seeing is that, obviously as a cardiologist, I was always fortunate to have the front row seat and to be involved in some of the most sophisticated, technologically enabled interventions, that benefited thousands, if not millions of patients all over the world because we truly saved lives. But then what occurred to me, which is what I think you're describing, is that our approach, this, what we call in my practice, we call it a fire truck analogy, right? So the modern medicine is a fantastic fire truck. If there is fire, you'll get a wonderful brigade, usually, of professionals who are able to assist to put out that fire. But the really such, this is just as in, the fire prevention, which is what patients really need to do, is on them, because the medical system is not really set up to provide this personalized, specific, tailored approach, or even to go down, into the basics to really tell this individual, hey, you've been prescribed a blood pressure medication, and that's important because it's going to keep you safe. But what's not going to keep you safe? Your poor oral hygiene is not going to keep you safe. Inflammation is not going to keep you safe. There's so many things that are going on. So you found a way to incorporate this into your practice. So tell us about that. That shift, that shift happened. You reached your breaking point, which is what it sounds like to me, because I've been there, I've done that. I reached my breaking point. I broke, I got assembled together, I broke again, got assembled together like Humpty Dumpty. But, so you reached your breaking point, and what's emerged? What is the sort of core philosophy of your practice, and what do you bring to patients to make their lives better?
Oh, I love that question. And I love that you use the firefighting analogy. I also use that in my practice because it's true. We are so blessed to have this amazing conventional system that is, it can be life-saving in accidents and just, catastrophic health issues. But we really need to shift our mindset as a whole society around how we approach medical care for chronic disease. And so instead of thinking of a firefighter, someone coming to put out your fire, I encourage my patients to take ownership of their health and become like a master gardener, where they see their health as something to tend to cultivate. And it needs attention, sunshine and water and weeding and pruning and care. And so it's really about empowering the patient to be, in charge of their own health and to be proactive.
This is so well said, because we also, we emphasize partnership with our patients. We emphasize patient agency, right? Because, the whole concept that chronic disease is a catastrophe and we approach it as a catastrophe
Yeah.
is flawed. Not to take away from life-saving interventions. Like I said before, there have been a multitude of life-saving interventions that are absolutely phenomenal. But why are we asking people to wait for the catastrophe to happen to take care of them, as opposed to giving them an opportunity to, just as you said, tend to their house garden, be involved sort of on a continuous basis, do things that are likely to promote their house. So expand this concept for us a little bit more. What does it mean to, have your house as a garden? I'm intrigued by that. Where does one start? Because I'm a city girl. I don't go I have a backyard, but I don't go into the garden. but I go through the garden. I like, looking at flowers and trees. I just, I don't think I'm going to get down and dirty in the garden. But so take us through that.
I love that. Well, as you know, one of my specialties is brain health and specifically cognitive decline prevention. Mm-hmm. I've done a lot of training. Dr. Dale Bredesen is one of my mentors. And basically, there are so many root causes of cognitive decline. And so part of the functional medicine approach is looking at all these different hormones and toxicity and micronutrient imbalances and inflammation. There's just a myriad of them. And it can turn into a big project for people. And so part of my philosophy is encouraging people to cultivate joy in the process. So building a life that is medicine, with rhythms of rest and renewal and actually enjoying whole foods and, experimenting with fun recipes and finding movement that brings your body joy and comfort, exploring creativity. And so I think part of the lesson that I've learned with functional medicine, even though it's a beautiful approach, it can actually create stress for people to have it be so complex and all of these action items. And so a big piece for me is helping people to relax around their health and create joy in the process of doing that. And so creating community around shared health goals and shifting mindset, from a fixed mindset to a growth mindset, where we're actually seeing illnesses and challenges as opportunities to learn about ourselves and what our body needs, and taking, gentle, grace-filled steps toward healing, instead of approaching it with anxiety and this big checklist that you have to conquer.
Yeah, this is so well put, because, I find this right now, it's sort of especially an issue, right? Because, as somebody who develops AI tools, I also, endorse their use for patients. And so needless to say, your patients and my patients probably fed whatever notes or labs they have into one of the AI engines. And I'm sure they came out with a long list of various do's and don'ts and sort of took them down various rabbit holes. But, I also, walk in the shoes of longevity doctors, because a lot of cardiovascular optimization is longevity, right? I always tell my patients, longevity is vascular, first and foremost. I don't care what you do, but if you drop dead of a heart attack, which is what happens to the majority of the population, you hadn't really, fulfilled your longevity mandate. But the problem with, I think, a lot of the medical practices in that arena, in that space, perhaps, is that it tends to be very complex, sometimes very expensive, without necessarily a clear path forward or clear outcome measures. And so that always bothered me because, there is always this possibility to dial in all these interventions and sort of throw a kitchen sink at a person. But that's not, in my experience, that does not lead to a sustainable change, right? It leads to anxiety and just overwhelm. And so how do you, let's say, focusing on cognitive decline, if you could give me sort of a flavor, who are those typical patients that you work with, and where do you start, right? Because this is just such a difficult part, right? A lot of patients feel that they're going to figure it out themselves. They're going to do it on their own. And, unfortunately, that doesn't work like that. These issues are they're both complex and complicated. So what does it actually look like in real life?
Yeah. Well, I take care of a lot of people in midlife, 40s to 50s and beyond. But we're all showing the signs of our modern urban lifestyle, chronic stress and inflammation and metabolic dysfunction, endothelial dysfunction. People come in tired, they're not sleeping well, they're stressed, gut issues, perimenopause, menopausal symptoms, high blood pressure, prediabetes, high cholesterol, inflammation. I mean, you see all these same patients.
We see it all. We see it all. This is exactly what we're seeing in ourselves to a certain degree. Right. So just I want our listeners to know that we're not immune. We're not special. We are encountering exact same issues that you're encountering. We're just maybe a little bit better prepared to handle them. All right. And so what do you do with these patients? Sounds like they sort of span, a gamut, kind of a fairly diverse swath.
So one of the beautiful privileges that we have in functional medicine, I've structured my practice where I can spend a couple hours with new patients, and we have them fill out extensive forms ahead of time to get their background and all their symptom patterns and review old records. And so it's just a beautiful thing to be able to sit down with someone and hear their health journey. And we start, preconception, what was going on with their mom and dad before they were even born, and their mode of delivery, each decade of life, major illnesses, accidents, traumas. And we just, first of all, let their story unfold and see what's important to them in terms of goals for their health. I always ask every new patient, if you had a magic wand, what would be your top 3 health wishes? And that's a fun thing. And then, of course, we sometimes do more than 3. Usually there's a long list of problems, but, we start there, with the history, their unique situation, their, work and family and stress. And we just get down into all the details of their life and their rhythms and even mindset is important. I'm always listening for shame and self-condemnation and those sort of things that can sabotage us, and then gently addressing it. So we start with that, and then we dive into an uncovering process of, I've worked with Dr. Dale Bredesen's framework of the different subtypes of risk factors for cognitive decline. And of course, you could look at them and see that they're similar, subtypes of risk factors for heart disease and cancer. And
so tell us, what are those risk factors? Because, once you drop the word risk factors, everybody's ears sort of perk up, right? So yes. And, I read, of course, the end of Alzheimer's and, looked, of course, at Bredesen protocol and, and it was uncanny to me how much a lot of its tenets overlap with what we do in our Fit New Genes program, right? So there are these areas of overlap, which is very significant. But let's assume that, perhaps our listeners may not know about these protocols. And, so what are those risk factors that Dr. Bredesen identified and you help your patients to unravel?
So I had the good fortune of meeting Dr. Dale Bredesen in 2016. And so, he shared this framework. Type 1 risk factors, 1A, are inflammatory and infectious. Mm-hmm. So, and the list of those things are, super long. Anything that's raising chronic inflammation in the body. So, rheumatoid arthritis or inflammatory bowel disease, a poor inflammatory diet itself, and then infectious, Lyme disease,
inflammatory job like residency,
stress levels, sleep deprivation, so many things fit under that category. And so I've had this practice since 2016. I create a little segment in the chart with these risk factors and just jot down each patient's individual risk factors within this framework. And so infectious is a wide variety of things that can drag us down. COVID-19 infection, Epstein-Barr virus, herpes, those sort of things. And then we've got that's tied very closely together to inflammatory is the glycotoxic. So the prediabetes, insulin resistance, diabetes, blood sugar dysregulation. And then we go into the atrophic subtype, which is, deficiencies of some sort or lack of growth factors that are necessary for optimal functioning of the brain. So you've got, B12 and magnesium, vitamin D, thyroid hormone, the sex hormones. So you're getting the picture. It's really all of functional medicine.
It is functional medicine on steroids, speaking of hormones, functional medicine on steroids. All right. Yeah. So we have, infectious, inflammatory, glycotoxic, and, do you find that, or is there more, or do you find that most of the time? Okay. So what are those?
So the next subtype is toxic. And that's, either environmental toxins, mycotoxins, heavy metals, environmental pollutants, or things we purposely put in the body, like mercury, amalgams, and dental fillings, and, alcohol, drug use, that sort of thing. So toxicity. And then you have the vascular. He has a whole subtype for vascular.
Yeah.
A lot of things go under that category. I even, put things like migraine with aura under that category because of how that impacts the brain and the vasculature over time. And then the final one is trauma. And, physical trauma, concussion history, but also, emotional abuse, sexual abuse, things like that in people's history. So I always screen for adverse childhood experiences as a part of my intake process. So it's a broad framework, and pretty much every risk factor known to humans is within that subtype categorization. So we go on this journey of peeling back the onion, just uncovering that through history, physical exam, vital signs, waist to hip ratio, VO2 max, grip strength, body composition, brain MRI testing with volumetrics, all of our diagnostics that we have, both the conventional and the functional medicine testing. So that's the journey. The first pillar of addressing brain health is just uncover what the risk factors are.
And that's a lot, It is a lot. So I'm curious because here is, one of the things I struggle with, and I don't know if you have the same experience, is that we know, right, in cardiology or primary care, we know the major risk factors for heart disease, right? We even have a name for them, right? We call them standard cardiac risk factors, and there is a bunch. We had Framingham study from way back when, before we were both born, that's been going and ongoing, and other studies after that. And so recently, we realized, and this has been around for decades, as sort of just like recently got formulated about, is that a lot of our patients actually don't have any of those standard risk factors, right?
Mm-hmm.
So we call them, actually, it's a funny name, we call them SMRFs, standard modifiable risk factors. So a lot of our patients are not SMRFs, right? And that was a cardiology article. I thought that was brilliant, like SMRFs. But, and this is sort of what I see, right? I see patients that on the surface, and, I'm saying on the surface because just like you, we do fairly in-depth, functional medicine informed workup. But, on the surface, they don't appear to be glaringly bad. Like, we do know statistically, for example, that, up to 70% or at least half of the heart attacks happens in patients with completely normal lipid profiles. Yeah. So are you, in evaluating patients with mild cognitive decline, in this framework, how often do you see that, yes, there is definitely something very obvious that may have been missed before, which is we do see it, in cardiovascular patients, of course, but that's not the majority. That's sort of, half or fewer, and there is this discrepancy between the burden of risk factors. Even when we do find standard risk factors, there's a discrepancy between the burden of risk factors and what it translates to vascularly. There are patients who seem to have risk factors, but their vasculature is preserved. And there are patients who don't seem to have them and the vasculature is impacted. And there are all sorts of permutations in between. So what is it that you are seeing, I'm going to say, in the brain health arena? Like, is it that we're just not looking hard enough and we need a framework like Dr. Bredesen, his Bredesen protocol, to uncover these less standard factors? Or, in other words, do we just not looking deep enough? Do we not looking at the right things? Once you do this workup, kind of, what are the top 3 things that almost always surface, and you can say, well, yeah, that's what's happening here.
Yeah, such a great question. And I would say, I think my intuition tells me that we're just not looking deep enough for heart disease.
Not looking deep enough. Yeah.
Within the brain health framework, everyone has multiple risk factors. Almost everyone has something from each category that's dragging their brain down. And I think some of the under-recognized risk factors are really, psychological trauma, emotional trauma, and the stress that places on the body over time with activation of the sympathetic nervous system. And we know that chronic cortisol actually can erode away and shrink the hippocampus, the main memory center of the brain. Yeah. And so, I think there's probably something very similar with the cardiovascular health in terms of, chronic stress and activation of the fight or flight system chronically, and what that does to the vascular lining. And so I think we're probably just not going deep and nuanced enough to understand the risk factors. But from my experience, we are all at risk for cognitive decline, for heart disease, because of modern living. We don't experience the regular rhythms and things that we need for optimal human health. Like, we're just bombarded with stimulation all the time, with
overstimulated. Yes.
Overstimulated from the news and social media and electromagnetic frequencies. And, we have our whole food supply is corrupted, in my opinion, with the ultra processed foods. And we don't, have deep restorative sleep and rest, our, on the go lifestyle. So there's just so many things that are, causing deterioration in our health. And we might not yet have a formal way to, categorize that or evaluate it within conventional medicine. But if you look deep enough, you'll find the risk factors.
So this is so true because, I'm going to sum it up because I think you and I are talking about the same thing, right?
Mhm.
Stress, right? And people are sort of desensitized to stress. They don't know what it feels like not to be stressed, to actually be relaxed. It's a struggle because even
Mhm.
if you think you are relaxed, sometimes physiologic parameters tell us otherwise, right? And so if I were to put a finger on one sort of factor that pulls it all together and initiates or potentiates all these metabolic cascades that we are seeing, the impact from the immune system activation, the impact from inflammation, maybe even brings inflammation to be there in the first place, I would say that stress is really the issue. And stress is not avoidable. I mean, you can avoid some of it, right? You can turn off the
Yep.
television, you can go home early from work if you have the luxury of doing that. But I feel like stress avoidance is not a truly sustainable strategy because for a lot of the times it's just not, you can't execute on it. But building stress resiliency, this is where the issue is. And I find that this is the hard part, and you're right entirely, because right now in cardiology, there's sort of this interesting slew of presentations and some articles about neuromodulation and vagal nerve stimulation and the effect of high cortisol on blood pressure, right? So hypercortisolism, that usually they say, oh, well, it's like Cushing's disease. But, well, most people don't have Cushing's disease, but they do run on high cortisol and they will have high blood pressure. So it doesn't matter how much you're going to diet or, you're going to exclude all sugars. It will help you a little bit. But when that cortisol does not get turned off, the blood pressure is not going to normalize. So this is, I sort of tell them, don't waste your energy on this because the real culprit is right here. And, it's almost like this famous phrase. I forgot who said it. I think it was a general during the Civil War. He said, we met the enemy and it is us. And so, and then this is exactly the situation. And, I will dig out this quote so that I can put it in the show notes. But, I think about it often. So, that we met the enemy and it is us. So how do you then, what is your first step in helping patients to at least start tending to their garden? Maybe it's filled with like weeds and the soil is dry, but let's start, tending to that beautiful garden that should be their health.
Yes, excellent. Well, so we've talked about all those, risk factors, and a lot of them have a physical health solution, nutrition or physical fitness, sleep, that sort of thing. But so much of our health also comes down to emotional health and spiritual health. So we go there. I bring out the feelings wheel in my encounters and revisit that, that we might have learned in kindergarten to identify angry, sad, happy. But there's, a lot more nuances to our feelings. And so, being emotionally intelligent, being aware of how our emotions are talking to us and how they drive us, how they drive our behavior and our decisions. And so, addressing that level. And then we also go, into the spiritual realm, and so many spiritual rhythms are healing for our cardiovascular health, for our brain health, going into silence and stillness and breathing. Those things can just be, the shift that puts us back into a kind of a restorative place and allows the body to heal. And so I encourage patients to, develop different practices. They're simple things. They're free, like doing a gratitude journal. Just one time a day, 3 things, just jotting it down. There's solid science behind that, of how that has an impact on our flourishing, our mental health, our physical health. So just taking time out of your day to actually be still and breathe and just kind
That's
of
very hard, I have to
your
tell you.
muscles.
That is very, very hard. I've been trying to work on that. That is almost impossible.
We get hooked into this, kind of like dopamine, cortisol, epinephrine cocktail of achievement.
The surge. Yes, the surge is driving us. Yep.
And so, being intentional about that and carving out just a few moments, it could even be 30 seconds of some breath work. Another practice that has been really helpful for me has been Sabbath, taking one day a week and just carving that out and saying, I don't work on Saturdays. And, it's a journey because we all have your available cell phones, computers, faxes, emails, all of that. But it is, I think, a really important discipline and practice and rhythm for our cardiovascular health, our brain health, our longevity. Is just dialing into these things that we were designed to experience, and then the modern world just kind of is too loud for us to pay attention to that. So silence, Sabbath, and then gratitude. That can make a world of difference. So, simple things, just, but it takes intentionality and recognizing that it truly is profoundly impactful. So helping people connect the dots between their lifestyle and their, stress levels and what's manifesting on their blood work and the blood pressure cuff, that sort of thing.
That is, honestly, that is profound, because as you were speaking, I was thinking to myself, wow, what a simple but powerful tool, right? Scheduling a spiritual time with oneself, right? Sort of just like unplugging and, for whatever it is, maybe it's just for a few minutes, but scheduling that spiritual time with oneself, recognizing that there are things, we are here in the universe, and, whether you are believe in God and you have a certain faith, or you sort of believe in anything else, but just, really expanding your mind's eye and saying there is something bigger than me, there's something more powerful than me, and I'm, privileged to know about it and to aspire, to be in its presence. Right. And, I'm a scientist, you're a scientist. And, part of it goes into the energy medicine, and, part of it pretty soon will be in the quantum computing arena. So we're going to come, I think to those interesting boundaries. And I think we're coming to them right now because, especially with very rapid advances in artificial intelligence and the progress that it's making toward, so-called, artificial general intelligence, or AGI, we will have to face, what makes us human, what is our spiritual connection to the world, because, our knowledge base is now available to whoever wants to type, a question in the chat bot. So, so what is our spiritual connection to the world? And I think this is profoundly, profound. So do you help your patients then, let's say if they're not spiritual, right? If they're sort of not following or not quite, aligning with this, they want, more of a physical intervention, right? Fix my insulin resistance, address my infections. How do you deal with that, in your practice?
Yeah, of course. Well, I take care of atheists and agnostics and people of all different faiths, of course. But I think we all have that basic understanding, or at least, awareness that we crave love and meaning and purpose. And so I think, just tapping into that, I find that with lifestyle medicine, that's a big part of my practice, that fear is a poor long-term motivator for making lifestyle change. It can work a little bit. It can kind of
short term it works. Yeah.
But we want to come from a place of like deep meaning and purpose and alignment with what what we feel we're here on this planet to do, what we're called to do. And I think, just exploring that. Most people are open to exploring that. What makes you feel deeply connected to humanity? What brings you joy, and what, brings a sense of love and connection and service. And so that's a big part of my work, is helping people to tap into that and then connect the dots between taking care of yourself, tending to that garden so that you can, have energy and show up with vitality and longevity to care for people, to be there for your loved ones, and to, work out your purpose in the world.
Yeah, that's very well said, and that's part of the growth mindset, right? Not part of the fixed mindset. And we know, unfortunately, who the patients are who come in sort of with the fixed mindset, we get these notes like, I want to be started on BPC 157, and that's the only thing I want. And so it's sort of, it doesn't, it's very difficult to explain to a patient who's sort of in that rabbit hole that the biggest solution for them is actually to climb out of that rabbit hole and be curious and be open-minded so that they can learn more about themselves, because we are results-oriented culture, and I think in many ways it hurts us, right? It doesn't give, I think, validity to, or even validation to this self journey that is not always fast. It's not always productive, right? But it has to be consistent, and it's that consistency which is so critical. So just like, at least what I'm seeing is that patients who are consistent, it makes the world of difference. They could take the simplest intervention that we talk about, and as long as they're consistent, the success is tremendous. And patients who are not consistent, who are, what I call experiencing a shiny object syndrome, or SOS, running from this supplement to that supplement, doing this, doing that, they're not really changing, and they're frustrated, they're anxious, and there's really no change in those patients because there is no consistency and there is no plan. And that unfortunately robs them all from that inner peace and purpose that they otherwise could have had. So it sounds like, you are in a way, maybe let's help our listeners to understand this a little bit better, because, people ask this all the time. What is the difference between functional medicine and lifestyle medicine, or even integrative medicine, right? Because people throw these terms sort of interchangeably. They're like integrative, functional, lifestyle, longevity medicine, alternative. Well, I hate that word, but sometimes people say alternative. So what do you feel is what is similar and what is different?
Love that question. And I think something you said about, just chasing after that supplement, like the peptide,
the shiny objects.
That's the error, the trap that we can fall into when we take the mindset of conventional medicine, that silver bullet approach, and try to then apply it to integrative and functional medicine. And it breaks down. It doesn't work that way. We are whole integrated beings, and we have to, we can't just Band-Aid the problem with an herb or, a nutrient. Similarly, we can Band-Aid the problem with a drug or an herb or a nutrient, but that's all it's doing. You're just kind of sweeping the problem under whatever therapy that you're doing. It's so I see holistic medicine as a beautiful term. It just means, seeing the person as a whole integrated human that has a mind, a body, a spirit, and needing attention and recognition on all of those levels. Integrative is maybe a bit older of a term. I identify as an integrative doctor. It's, taking conventional medicine and all the brilliance of it with the diagnostics and therapeutics, and then pulling in complementary therapies, whether that's, herbs or nutrients or prayer or massage therapy, just integrating them into a whole. Functional medicine is a whole new way of thinking about health. I think the tagline is something about, changing the way we do medicine and the medicine we do. So it is pretty radical. It's the idea. And to me, it is just good medicine. It's looking at the individual who's in front of you and their unique biochemical fingerprint, their genetics, their lifestyle, their environment, their, health timeline, and addressing them as a unique individual, and looking for those root factors that, and seeing the body as this integrated whole, where we're not just like treating the heart over here and the brain over here and the gut over here, but that all the systems overlap and influence each other in a beautiful way. And so it's very empowering to practice medicine that way, because when you do something good for the heart, like you're doing with your patients, you're impacting the brain in a positive way and the whole rest of the body in a positive way. So it revived my faith in medicine and just my enthusiasm and passion for it, to be able to really get to the root of things and, address things from a more holistic understanding of humans, that we're more than just a bag of organs.
We're more than just the sum of our parts. I mean, this is so well said, because I think, this distinction, even though sometimes people kind of just blow past it, but I think this distinction is so important, is that the integrative medicine, and I also identify as an integrative medicine physician in many ways, even though I'm trained and certified in functional medicine, but at its core, integrative medicine as a concept was perhaps an older concept, and it was basically just bringing in less conventional approaches into the medical practice, like acupuncture and massage and maybe supplements. But, in a way it was adding in, it wasn't necessarily creating something new. I think a more contemporary version of integrative medicine, what we would probably call precision medicine, is where we have a chance to kind of put the root cause approach of functional medicine and the structural, sort of specific interventions that integrative medicine usually includes. We get to put it together and personalize it for a patient, and then it becomes precision, personalized. Our tagline is that we make precision medicine personal, which is exactly what we do, because, you can either go down the path of medications and procedures, and or you can go down the path of precision and personalization. There is an overlap, right? We can't tell a patient, nor is it safe, that they can only do, be drug-free and never have any procedures. That just doesn't work like that in life. But it's really trying to figure out what are these root causes and how we can lean in and lean out in order to grow this beautiful garden. So I'm very curious about something that, some new ways of thinking that are emerging right now. Like, we used to think that, at least in cardiology, that maybe 30% of heart disease has some sort of a hereditary component, right? An article just came out recently in Science where investigators looked at twin studies, and they kind of teased out certain risk factors that were maybe clouding the picture before. And they said, no, up to 50% of what happens with us, is actually, it is, especially in terms of longevity, up to 50% is actually genetically determined. So do you agree with this? And, what are you seeing specifically as you work with patients that have concerns or have issues for brain health? How much of it is genetic? And, and I'm curious, sort of like, what's your take on genetics? Because, you and I, being in the functional medicine domain, we see genetics a bit differently, I think, than some of our conventional colleagues. So what are your thoughts on that?
Yeah. So, well, in terms of my niche, which is cognitive decline prevention, largely Alzheimer's disease is main cause of dementia. There are multiple different types of genetic risk factors for Alzheimer's disease. Some are very, very serious and very, potent in terms of like the amyloid precursor protein or presenilin 1 and 2. They're, pretty much autosomal dominant. And if that is in your family line, it pretty much comes in each generation. So those are, very unfortunate genetic mutations. There's, the ApoE4 is the much more commonly genetic variation called the Alzheimer's disease gene. And it's present in a good proportion of the population. I have many patients in my practice with a copy of the ApoE4 gene, and even a handful that have 2 copies that are doing well in their, 70s, late 70s. And so I don't see it as the end all be all. There's the old saying we were taught in medical school that, genetics loads the gun and environment pulls the trigger. And so it's a combination of nature and nurture. I would say there is so much that we can do to impact all the rest of the risk factors that there really is hope for people if they have a copy or even 2 copies of the ApoE4 allele. There's other genetic factors that play into the risks that can make it more or less depending on other factors. I love functional genomics. I actually have the amazing privilege. We just hired Carol McCarthy. She's a functional, she's a genetic counselor with a lot of background in cognitive decline. And so that's part of our practice is, advising people about their unique genetics and their SNPs and how they can tweak and modify their lifestyle to be able to hopefully mitigate some of the impact from genes. But it's a real thing. When we have genetic variations, we have to take them seriously and just address them the best we can.
I agree with you 100%. And to be honest with you, we pretty much run genetic analysis on all of our patients. There are very few times when we don't. And after having done, I think I'm approaching 200 of them at this juncture. One of the things I can tell you is that I don't think it is even possible to have an effective plan in place if genetics is not accounted for. So genetics is not, a final sentence. It's not, something that like, oh my goodness, because you have these genes, things are going to be very bad for you, except with very few exceptions that you mentioned, that, very, very few people potentially may be heavily burdened by genetics. But in terms of what we can do a lot. And it's not just, for complex diseases like heart disease, Alzheimer's type of dementia, cancer. There really isn't one specific gene or even series of genes. It's more about pathways and it's more about interactions. And, majority of cases of Alzheimer's still happens in patients who are not ApoE4 carriers, but, they potentially may have genetics that predisposes them to experiencing increased toxicities, even from common environmental stimuli, or not being able to process nutrients well. And that's where the whole methylation reaction kicks in, or having, issues that are impairing how their neurons maintain themselves or regenerate, or having a sort of a predetermined genetically higher immune and inflammatory potential. And, the remarkable part is that we have labs that currently are available to practitioners like you and I that could give us this very high fidelity genetic information that isn't just, based on a specific, variation in a single place in your DNA, which is what SNP actually is, stands for signal nucleotide polymorphisms. But we can actually string these variations together and look at genetic pathways and say, well, this is the pathway. That's the road that, your body has been set to travel. And how do we make sure that if it's a good road, you stay on it? And if it's not such a great road, we'll actually slow down, the journey or stop it in its tracks, So I think there is a tremendous opportunity. And, we tried at Holistic Heart Centers, we actually use AI for this, believe it or not. It's called Heartwell.ai. And so what we do is that we feed all the information, laboratories and genetic results, as well as some imaging results to really derive this unique profile that our patient may have so that we can even simulate the interventions before they happen. And, I have to say this has been very successful because we use this approach to really cut down on medications and, and use them judiciously when needed, really showing that there has been improvement in blood work, lipid parameters, metabolic parameters. And, while it's not the only thing that determines heart and brain risk, it is a powerful determinant, right? This cardiometabolic out there, up to 30%. So fascinating. So Dr. Cindy, how could the patients find you if they wish to work with you? What's the path?
Yeah. So we have a website, of course. caringforthebody.org is our practice website. So you can find our contact information there. I have a YouTube channel called Rethink Aging with Dr. Libert. So you can subscribe to that for, free information.
Awesome. I'll definitely subscribe to Rethink Aging with Dr. Libert.
Have you on the podcast.
That would be awesome. And I think, I think my goal, my hope, and, I'm sure Cindy, that's your hope too, is that for our listeners to understand that they have the tools, they have the means, right? This, as much as we have witnessed, decade after decade, unfortunately, a relentless progression of chronic diseases, Alzheimer's type dementias, even heart disease. We managed to curtail its mortality and sort of hold it steady with some kind of, up and downs recently. But we hadn't really managed to dislodge heart disease as the number one reason for death in both men and women, and when, heart disease and brain disease are degenerative brain disease like Alzheimer's type dementias are very closely related. And as I promised at the beginning of the show, is that the study just came out, a very interesting study using an old medication that we use in cardiology quite often. It's actually called Ezetimibe. It's generic, brand name is Zetia. And so the scientists used animal studies to unlock a very interesting hypothesis. It turns out that ezetimibe potentially may prevent Alzheimer's disease by working in a very specific pathway. They call it a linchpin pathway because it's sort of like, two proteins that are supposed to be apart. They don't get appropriately separated. The brain debris does not cleaned out. And so there's a biochemical reaction that sort of clumps them together, right? Which is what Alzheimer's, right? Accumulation of proteins, amyloid, tau protein. We know that's where the issue is, right? That's what plugs up the neurons. So it turns out that ezetimibe actually separates this linchpin. And so the clumping doesn't really happen so that the cellular debris can clean out. And so what was fascinating is that they ran, retrospectively, they looked at 900,000 patients, maybe even a little bit more. They were from UK Biobank, and they matched them by age and gender. Didn't really match them by level of cholesterol. Ezetimibe is a cholesterol lowering drug, but they matched them for age and gender. And they said, well, is there a difference between people who are taking ezetimibe and people who do not? And sure enough, people who were taking ezetimibe had a profound, 7 to 10x decrease in Alzheimer's disease occurrence. So, so stay tuned for that. This is just amazing new study. I'm going to put some information about it in our Holistic Heart University. The Holistic Heart University does have a free tier. If you like this type of information, I'll put a link is in the show notes. Just sign up and, you'll get like a little cliff notes of what I just said so that you can store it for your own use and repurpose it. Cindy, thank you so much. It was a pleasure having you.
Thank you so much, Regina. It's been a great pleasure.
Bye-bye.
Bye-bye.
Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Heart Centers. If you enjoyed the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticheartcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.